We now start the discussion of the implementation of the Hong Kong Good Manufacturing Practice Guidelines for Proprietary Chinese Medicines. And also, we have the next item, the role and work plan of the Government Chinese Medicines Testing Institute. I don't think we have a lot of time left, so we're going to start the discussion of these two items altogether. Undersecretary, would you like to walk us through the paper, please? Yes, this is an item on implementation of the Hong Kong GMP guidelines for PCMs. This also called Hong Kong GMP Good Manufacturing Practice. This is the globally adopted quality assurance approach used by drug manufacturing industry to ensure that products are properly produced and controlled. I think that we have just had an extensive discussion on matter, so I'd just like to highlight the following. The CMPR will be set up and it will take forward the implementation of the Hong Kong GMP guidelines. The industry will also be consulted for implementation to further enhance the quality of PCMs in Hong Kong. Members will find details in the paper. The third item relates to the role and work plan of the GCMTI. The Department of Health set up the testing center in 2017 to develop internationally recognized standards and testing methodologies to enhance quality assurance. The permanent GCMTI building commenced operation in December 2025 in Tseung Kwan O, Pak Shek Kok. Under a phased approach, there are 4 major facilities. The Advanced Laboratories International Collaboration Training Center, Chinese Medicines Herbarium and Laboratories, as well as Shenong Herbal Garden. Following the blueprint on the development, our Chinese medicine development blueprint will continue to adopt global vision, leveraging our advantages in traditional TCM and our R&D clinical capability to improve quality control of PCM and talent training so as to promote innovative development of Chinese medicine and promote standardization and modernization of the industry. The GCMTI will introduce the state-of-the-art testing technologies and indicators to develop the standards of PCMs in Hong Kong, to bring them on a par with the international standards. The GCMTI will also incorporate the high-end analysis of medicines and into the system, and there will also be transfer of knowledge on testing technologies to the industry to enhance the professional capability of the industry so as to promote industrialization of CM testing. We will also collaborate with the institution in the Greater Bay Area and the mainland to further promote regional collaboration and enhance the quality of Chinese medicines. The GCMTI will continue to improve the Chinese medicines herbarium as well as the digital herbarium so as to enhance collaboration, and there will be diversified development, and we will work with the community to promote the concept of Chinese medicines for safeguarding health so as to promote the culture of Chinese medicine. And we will also be the bridgehead, and we will take forward internationalization and also standardization of PCM. We will take part in international initiatives such as the WHO International Regulatory Cooperation for Herbal Medicines, IRCH, and Western Pacific Regional Forum for the Harmonization of Herbal Medicines, FHH, so as to align the CM testing methods and standards with international practices and drive global development. Details can be found in the papers. We welcome questions and comments from members. All right, thank you, Undersecretary. Members, if you want to speak, please press a button. 3 members waiting to speak, Mr. Chen Pui-lam, Mr. Alex Huan, and Ms. Rebecca Chen, as well as myself. Let's start with Mr. Chen Pui-lam. Thank you, Chairman. My question is this. For PCM manufacturers, in order to meet the GMP certificate requirements according to the paper, one of the pain points is the location of the factories. This is a matter of their concern. Many traditional Chinese medicine manufacturers set up plants in aged industrial buildings. And in terms of spatial requirements, it's very difficult to meet the GMP standards. There aren't many suitable facilities that could help them meet the standards in the market, or the level of rent would be very expensive. Is there a timetable for full implementation? Will the government consider setting aside some land in collaboration with tech firms in industry parks or in the northern metropolis so as to allow shared use of factories for GMP manufacturers to meet the requirements, so as to address the pain point of SME manufacturers not being able to find suitable locations for their factories? About the GCMTI, there are 4 major facilities. I am concerned about the 4 advanced laboratories. These laboratories will be responsible for developing innovative, faster, more accurate, and highly versatile testing methods for CMs. So for these advanced laboratories, their focus is on R&D. Does it mean that after the R&D stage, the outcomes will then be passed on to the laboratories in the market for testing? What about the patent rights? Who owns the patent? Is it the government, or is it for free use by the market? And about the testing methods, are they available in the private laboratories?
Thank you for your question. I can defer to the DA to give you a more detailed explanation as to whether the Northern Metropolis can promote the development of a CM, or the Northern Metropolis will be the engine for future development. Of course, it will bring new vibrancy. Well, we do have the Sentin Technopole, and that will also provide us with land resources, and we know that the will be able to, with development in 2026, to make use of our geographical area to help with future development. For some high quality products, then there would be value added support such as research and development, training, monitoring and accreditation, etc. But I can say that the Chinese medicine industry can also consider using the Hong Kong Science Park in Tai Po and Yuen Long to promote development. I'll let the DH answer the other questions. In the GCMTI, there are 4 specialties of advanced laboratories. We hope to use these cutting-edge technology to come up with internationally recognized CMs. We also have a technology transfer center. Some centers will be able to hold forums so that when new technology comes out, we can directly transfer the technology to the CM sector for application. How do we choose these technologies? the GCMTI has an advisory committee with representatives from different sectors, from the CM sector, academia. They know exactly the pain points and what is needed and will be able to look into new technology to support them. Such technology will be open for use in Hong Kong so that Hong Kong can become a high quality monitoring center, and that everyone in the sector can work together so that it can become a strong industry in Hong Kong. Thank you. Mr. Alex Fan. Thank you, Chairman. GMP will be fully implemented as stated in the paper. In para 6 of the paper, we see some of the industry's concerns, including premises selection, capital requirements, and so forth. I'm sure that the administration will further consult the sector on this. On capital requirements, have you considered working with the Productivity Council or come up with funds to help SMEs? The second part is a comment and a question. Since we do have a timetable for the full implementation of GMP, for those manufacturers who are not able to achieve this standard by the deadline, would there be a mechanism to help them transition? Because we don't want to cut across the board. I hope that you can come up with ways to help those who are not able to reach GMP certification. Thank you for your question. There are different projects under the fund. Our main focus is on the support project on Chinese medicine approval and sanitization. They can actually seek consultancy services or to look at the SOP services, or sometimes support on the application process. They can also better equip themselves. Other than this main funding for GMP, there are also other projects under the fund, which includes supporting them in GBA integration, talent training, etc. Since the establishment of the fund, we've been optimizing the fund to provide suitable support for the industry. And this is quite an effective way. But other than money, we also need to focus on technology upgrade, and there are different platforms under the DH to support the sector. How about for the factories who cannot comply with GMP? Commissioner, please. Thank you, Chairman. We are preparing ourselves to amend CAP 549 to gradually implement GMP. If we are to make GMP a requirement, then some factories may need to transition or exit from the industry. We would, of course, ensure that we consult the sector to know their needs. For example, to see how many of them would try to upgrade themselves to achieve GMP, how many would exit from the industry, and what the exit mechanism could be to ensure that they could transition smoothly. We are going to consider all this in phases to ensure that all the sectors could transition. Next, Ms. Chen Hoyan. Thank you. GMP is a very good system. It is actually an accreditation that is recognized internationally, and it's a quality assurance approach. Well, looking at Hong Kong, there are 265 PCM manufacturers. How many of them have achieved GMP? Only 21, which is not even 8%. How many manufacturers in Hong Kong are you looking at to achieve the GMP standing? Out of the 265 licensed PCMs manufacturers in Hong Kong, if we are to make Hong Kong into a well-known PCM manufacturer, we may need a higher percentage with GMP certificates. But currently, we have 21. How many do we want to achieve? Can we use GMP as one of our advantages, that we could have the most GMPs amongst other places? Can you tell me whether you have visited all these 265 manufacturers in Hong Kong? Some of them are not able to reach GMP status because you have to make sure that there is a good premise selection, and sometimes we cannot just blindly ask them to fully implement GMP because they are not able to do so. Some of them do not have the adequate hardware. Have you visited these places? Well, we need to go into the details. Well, out of the 265 manufacturers, 21 have been issued with GMP certificates. How many more can actually be eligible or will be able to be issued with the GMP certificates? We need to know the percentage. In the long run, we want to have a high number of GMP certificates in Hong Kong. Some factories or some factories may actually be doing well, but they may not be able to find a suitable premise in Hong Kong. Can they actually move their premises to the mainland? I want to see how you can further support the industry. By the end of the year, how many more do you think could be issued with GMP certificates? Or how about in 5 years? Do you have such a figure? Undersecretary. We wouldn't set a goal of how many manufacturers would be issued with GMP certificates by the end of the year. Previously, we encouraged them to apply for GMP, but now we have shared the plans with them that there is going to be full implementation in the future. Can we attract other manufacturers to set up factories in Hong Kong with this implementation? We do have plans, which the DH will share with you. Thank you for your question. We understand the uniqueness of Hong Kong. Hong Kong is very small, and there are many difficulties in locating suitable premises. Would some Hong Kong brands choose to move its production line to the mainland? I can share with you some examples. Some manufacturers will commission their production, so they would have the production done by well-known brands. If they need to move a production line to the mainland, we do have a mechanism to allow them to apply for GMP through a new production line. So this is already in process. We maintain close contact with the sector. They do have factors that affect whether they apply for GMP or not. We have streamlined the PCMs for oral use, which is they can actually expand the network to the mainland so that there will be enough capital to apply for GMP. We see that the industry is very encouraged by this, and many are working towards that. But each manufacturer has a different sales model. We hope we would gain a better understanding of each manufacturer and to know about their wish to apply for GMP before we continue further. Well, I don't think you're understanding Ms. Chan's question. She is asking, out of the 265 manufacturers, how many of them could actually be successful in applying for GMP? So you have to estimate how many could reach GMP status. You need to come up with an estimate number because some of them would find it impossible to achieve. Well, thank you for following up for me. We know in Hong Kong that there are 265 PCMs manufacturers. 21 of them have been issued with GMP certificates. Well, you tell me that at 21 out of 265 is already quite outstanding because even though it's less than 8%, it's already a lot. But would actually this be a huge achievement compared to other places? It's actually a high or low figure compared to other places. We must know whether we are competitive enough or not. Because if we want to go global, we can tell the rest of the world that we already have a very strong GMP standing. That's the first question. Second question, GMP is internationally accredited. If we know some manufacturers are too small and would never be eligible, why would we provide them with funding to try the GMP certificate? Because we know they would never become successful. Have you visited all these 265 factories? Maybe out of these, only 100 would be eligible. Then we can decide how much money we can invest to help them. Otherwise, how are we going to appropriate funding for you in the future? We hold a subcommittee because we want to discuss in detail how we can support the industry. GMP is not unique to Hong Kong. This is actually an internationally recognized practice. How many manufacturers can we support? I hope you understand my question and not just to tell us that, oh, we are going to support them in achieving GMP. If you're not able to do that, then all of them would just close down. It's just that they are not able to be issued with a GMP certificate. I'm not saying that their standards are not high enough. We need to know how many of them could actually achieve it, how many of them cannot. We need to know the positioning. Well, if there are 100 that could be issued with a GMP, then we could focus on supporting them. Do you have such figures for us?
Thank you, member, for the question. In fact, we plan to conduct a comprehensive survey. There are 265 manufacturers in Hong Kong. We are aware of their size, distribution, and establishment. Now, the problem is this. It's up to the manufacturers to upgrade their operation to meet the GMP standards. It has to do with the capital and manpower arrangements. And that is why we have begun a detailed study to assess the difficulties facing local manufacturers. For example, in terms of the size of the factories, is it possible to conduct a renovation and a revamp? There are two ways to go by it. That is it possible to upgrade the existing factory to meet the standard? The other way is this. Like the Undersecretary said, whether it's possible to relocate that operation to a new base, say in an industry park, so as to fully upgrade their production capacity. There are successful examples. After we conduct a full survey, we'll be able to have a better idea of where the problem lies and what the solution is, so as to implement measures to help them improve the operation. So, Chairman, my question is, does it mean that you have no idea how many among the 265 are interested in upgrading their operation to meet the GMP standards? Are you going to conduct a survey within this year? Yes, we are going to conduct a comprehensive survey within this year so as to complete the database. Right, do give us information. This is our concern. Mr. Dennis Leung. Now, if only 21 out of the 265 manufacturers have been issued a certificate for GMP manufacturer, that means 240 plus of them failed to obtain the GMP certificate. Then from the public's perspective, they are concerned about safety. They don't know if it's fit for consumption. For Western medicine, I know that GMP is mandatory. A few years ago, local factories, in fact, suspended the operations in order to revamp the production line to meet the GMP requirements. In fact, I have been taking medicines, and that happened to me as well. That is, for Western medicine, they are willing to comply. For Chinese medicine, it's in fact covered by the National 15 5-year plan. We want to modernize the industry, and this is one of their goals. As we drop the first 5-year plan for Hong Kong, you should help the industry solve problems facing them. For mainland businessmen or local businessmen, we have a Go Global task force to help them tap overseas market. Likewise, a dedicated unit should be set up to help Chinese medicines industry. You can be the coordinator when it comes to setting up factories, so that in batches you will be able to grant approval. And in fact, in the science park, there are mainland pharmaceutical companies. In the end, they bring the production lines back in the mainland. They don't manufacture drugs here. So, do you have a mechanism to work with the ITIB, for example, so as to help local products go global? Undersecretary. Thank you for the questions. Under the ITC, there is a new industrialization funding scheme as well as the new industrialization acceleration scheme. These two funding schemes cover the manufacturing of Chinese medicine. On a matching basis, these funds subsidize local manufacturers or manufacturers in setting up smart production lines in Hong Kong. And they can get subsidies up to $45 million. As for the NIAS, the focus is on life and health tech, AI, data science, advanced manufacturing, new energy. The enterprises in question should set up and invest at least $100 million in the smart production line, and then on a matching basis, each enterprise can get up to $200 million. So I thank the member for the comment. If the manufacturer is minded to set up a smart production line to enhance local capacity and help, our government will be more than happy to help them upgrade and transform. As for measures to help smaller manufacturers, in fact, we've been discussing with the sector and we've received suggestions about a centralized manufacturing base so as to help small to medium-sized manufacturers so that they don't need to expand their factory space and instead they can make use of the shared space. But simply put, there are lots of hurdles. For example, there may be cross-contamination of in the process of producing different Chinese medicines. We need to have regard to the scale of production of different manufacturers, the quantity and technical requirements, and some of the manufacturers have secret formulas they don't wish to share. So there are lots and lots we have to consider. Maybe the Department of Health can further supplement why this is not a feasible option. Thank you, member, for the question. About the central kitchen, so to speak, we're aware of this suggestion. But the problem of a central kitchen concept is this. For example, in terms of design of the factory or the kitchen, so to speak, for a production line of an ointment or a CM for oral use, there may be different requirements. Say if it's something for internal or oral use, during the extraction you may need to prepare a very big container up to 10 meters high, and that means you need really good clearance in terms of design of the factory building. But if you manufacture an ointment, it would take only 3 to 5 meters of clearance in terms of space. So if it's a central kitchen, there are different requirements in terms of hygiene, clearance, and then if you invite different manufacturers to use the space, it will take a lot of money in terms of cost to retrofit the central kitchen with different equipment in order to meet the requirements of different production lines. So this is not a feasible option. Rather, there is a very good initiative under the fund, and that is we invite the factories to conduct an assessment, the differential assessment. That is what clearance of the structure they need, the quantity of their production, and so on and so forth, so that we could find the most effective way for the smart production line to be set up that fulfills the GMP requirements. Next, Reverend Pt2. Thank you, Chair. I want to follow up on the GMP manufacturer question. Now we have 265 CM manufacturers, 21 of them have been issued the GMP certificate. I'm not too concerned about the certification, but then among the 265 manufacturers, some of them may be manufacturers of long-standing, well-known products. They have been around in our community for many years, and that these manufacturers may not have the incentive to apply for GMP. The government just explained the difficulties in developing shared factory space or central kitchen. But will you consider trying to solve the problem, say in terms of medicinal oil or ointment? I remember that I used to have a primary school mate whose family ran this business. I don't recall the name of the brand, but then the formula is really good in treating, say, headache, and it's actually ICH property for us. Is part of Hong Kong brand. So I'd like to know from the administration what will be done to help them. They operate on a rather small scale. So if the investment requirement is too harsh, they may not be able to meet it, and they might as well just cease operation altogether, and this is not good for the Hong Kong brand. I'm not too familiar with this area, but then is it possible to provide subsidy to these smaller players so that they can manufacture the medicinal oil together and achieve economy of scale? I want to be pragmatic. My goal is to help the small manufacturers, because despite good intentions of improving things, you might actually force them out of business, and then some of these local brands may disappear altogether. Thank you, Chair. Thank you, members, for the question. Let's take a closer look, because when it comes to GMP, it is almost the basic emission requirement for medicinal products around the world. Just now, another member asked about the situation in our country or in other places. In Macau, the Taiwan, China, Singapore, Malaysia, Australia, US, Europe, these countries have all imposed GMP requirements on Chinese medicine. So there is no wiggle room. We'll definitely implement GMP as well. But we need to address members' concerns, and that is for the remaining 244 manufacturers, what we should do. And I thank members for the reminder. We need to get a thorough understanding of their wish. We need to consult them. And for the pain points mentioned, we want to help them overcome the hurdle. And that means whether they want to relocate to another place to set up a production line. If that is the case, we will help them. And we'll also try to attract other CM companies to set a presence in Hong Kong so that we can scale new heights. The DH can supplement in a moment, but definitely we will fully consider reference code suggestion.
We only have 15 minutes left, and we have been carrying out a very thorough discussion. Well, if you do not mind, if needed, we may need to add 15 more minutes to the meeting. DH, please. Thank you. Thank you, Chairman. Whether implementing GMP will actually cause some small manufacturers to exit or be eliminated from the market. We have considered this. Some SMEs, especially as small manufacturers, may not have the capability to implement GMP. They can actually commission their production line. We have actually seen this before. The ITC has also done this before to support PCM manufacturers, that they can actually help with processing to achieve GMP level. There's also another way to commission the production to the mainland to achieve GMP level. The manufacturers can either upgrade themselves or actually commission their productions to achieve the GMP to meet the full implementation of GMP in the future. So you're talking about sharing to achieve GMP level. So the manufacturer cannot say that it's a GMP manufacturer. It can only say that it is produced with GMP standards. And then what happens after? There would be two situations. First of all, the manufacturers, if they want to continue to be manufacturers, can have their most complicated process, such as making the medicine into granules to the factory. And then they can actually retain the GMP level by doing packaging, because we believe that it will be more easier to achieve. And in Western medicine, there are many licenses that are only for the GMP packaging. Or another situation would be the manufacturer commissioning all the production and the packaging to others, and they will still be the proprietor of this medicine. So it will depend on the decision of the manufacturer to see which circumstance they would want to adopt. I have a suggestion. I'm not sure how many there are in doing this. It is quite a good method, but you have to make sure that there is enough to support all the GMP manufacturers in Hong Kong. Next, Dr. David Lam. Please turn on the microphone. I'm not sure whether this question has been asked. I'm concerned with actually the effect by using both Western and Chinese medicine. I understand that the hospital authority has collected a lot of data and analysis, but it seems that other than the HA, we do not need whether there are any figures in showing the conflicting effects of Chinese and Western medicines, and sometimes that poses a difficulty to us. I want to know whether the government has plans to provide more information on the effects between Chinese and Western medicine, and whether there is such a timetable. Or as a Western medicine practitioner, I first need to know what kind of Chinese medicine the patient is taking. If the Chinese medicine practitioner can also put this on e-health, then I can take a look at the efficacy of the medicines. But can you actually try to upgrade the system that when I go into e-health, then there will be a notification saying that certain medicines would have a conflicting effect with Western medicines? I also like to ask about the training of Chinese medicine practitioners. Colleagues have asked about Chinese medicine pharmacists. I'm more concerned with the practitioners. There are only 85 graduates per year. And every year, only about 200 non-local people can practice and register in Hong Kong. That's a lot more than our local graduates. In the long run, would you consider expanding the scope of training in Hong Kong? We will be able to set our own standards and monitor the standards. Our training can also be decided by ourselves. And when there are more students, then we would have resources to recruit more professors and conduct more research. I hope that we could expand the scope of Chinese medicine training in Hong Kong. You may question whether there are enough students. On the reverse, when we have our own training, we can also attract people to come study in Hong Kong. And once they complete their studies and practice in Hong Kong, it can actually help us increase the number of Chinese medicine practitioners in Hong Kong. And lastly, I would like to ask about GMP. We have received inquiries on manufacturers who have received a GMP certificate. They're able to receive the C label locally, but then problems arise when they try to sell it overseas. The regulations elsewhere differs from Hong Kong, and the products would be sold as a non-Chinese medicine product. Well, with the C label in Hong Kong, can they also safeguard their label overseas and sell it as a registered Chinese medicine as well? It's like Western medicine. In Hong Kong, we do not see the FDA number. You don't have to add in the origin, but then it will be strange when we impose this on Chinese medicine. Well, there are three questions. First of all, on the conflicting effect between Chinese and Western medicine, we would develop it in the blueprint. Our commissioner can tell us more about it. I'll just like to say that in the past weekend, we held an international conference on Chinese medicine and integrative medicine, which was actually organized by the hospital authority, and many experts came together to look into Chinese and Western medicine. This is a very important conference. Led by the Chinese medicine of Hong Kong, we looked at the effects between herbal medicine and Western medicine, and it can actually help promote our evidence-based medicines. We hope that next year we can set up a formal international forum next year. So this will be a huge milestone. We do have a lot of support in looking at the effects between integrative use of Western and Chinese medicine. Thank you. About the interaction between Chinese and Western medicine, a decade ago, we've already started Chinese medicine services, and sometimes patients do use both Western and Chinese medicine. Starting from then, we've been starting these services, and there has been HA guidelines for safe use of Chinese and Western medicine simultaneously. Very often, these are done clinically. Therefore, you would not see this in primary health care. If we are to put our hospital guidelines into the private sector, then we must ensure that it will be suitable for use in outpatients first. So through the Chinese Medicine Development Fund, we have asked a university to conduct a research to see how our clinical trials could be adopted elsewhere. We want also to introduce international methods into Hong Kong and to ensure that these will be suitable for use locally. And we also want to be an influence overseas. We hope that through e-health, both Chinese medicines and Western medicines could be used. And by adopting AI, we hope that a notification could pop up when there is a use of Chinese medicine, or that a warning would pop up. We hope to achieve this in the long run. I'll talk about talent training, and then the DH can explain further how local PCMs can be sold overseas. We can cultivate different talents. Currently, our universities have set up curriculum or courses on Chinese medicine. The blueprint will focus on the support to CMs. We would conduct research and analysis and then enhance our research and promote innovative development. We have to first understand capabilities and provide relevant training to enhance the competitiveness of the industry. Other than the academia, we have mentioned earlier that we are also working with the National Administration of Traditional Chinese Medicine, and together in our technology transfer laboratories, we would also provide training, and by conducting exchanges, we'll be able to attract more experts. And so we have been working on this. Thank you.
The DH will supplement about export of Chinese medicine. Under the CMO, there are requirements on exporting Chinese medicine products, including the labels. When it comes to regulation of Chinese medicines and herbal medicines, traditional medicines, there are different regimes. In Hong Kong, we adopt a different regulatory regime, that HKC is a mark of confidence. But in some other places, such medicines may only be registered as a health supplement, not as a medicine. So, for manufacturers which would like to have their products registered in Hong Kong, they might need to get the HKC number. I'm sorry, can I ask a follow-up question? You haven't answered my question. Some manufacturers don't want to be some manufacturers don't want to be considered as manufacturing medicines, as registered medicines in Hong Kong, because this is not permissible in other places. Now, in such circumstances, can you allow the products not bearing the HKC number? If that happens to Western medicine, then why not to Chinese medicines as well? I want to supplement that according to Section 27 of the CM regulation, there are 3 requirements in terms of labeling for CMs for import-export. And these 3 are the name of the medicine, the licensee or the certificate holder, as well as the HKC mark. The object of the legislative intent is to enhance traceability of the product, so that even if this product is sold overseas, people will be able to verify that it is a registered product in Hong Kong, and that on the website of the CMCHK you'll be able to check and verify the information. So that's the design. As for Western medicine, I want to explain the different approach in its regulation. For Western medicine that are sold locally, they should be registered first. But rather, if we export Western medicine to another place, there is no need for the product to be registered in Hong Kong. For CMO, there is a different objective. We want to promote local CM products to overseas market, and that is why these products must first be registered in Hong Kong before they are exported and sold in other places. So they work on different bases. For Western medicine, it's rather straightforward. There is no regulation on export of the drugs, whereas for Chinese medicine, we want to ensure that for products sold to overseas, if they would be safe and of quality. So that's the biggest difference. Now, when we come to the drafting of the CMPR regulation, will you reconsider this point? I'm not against the stringent registration approach in Hong Kong, but that is it really necessary for the packaging to bear the HKC number as well? I hope you consider that in the drafting stage, because you are putting an obstacle for quality Hong Kong PCM products to sell to other places, because if they're registered in Hong Kong and if they bear this mark, it's difficult to comply with the overseas regulatory requirements. They can't sell in the other market. Well, we will give it a thought in our review. I'm the next to speak. I have a question I want to ask about GMP 265 GMP manufacturers. Only 21 of them have been issued the certificate. For SMEs, it's very difficult for them to upgrade and transform. Usually, if you want to upgrade a factory, it will take over $10 million. And the CM Development Fund provides subsidies at a cap of $1 million. It's just a drop in the ocean. So in order to further enhance the industry's competitiveness, if you want to help the industry upgrade and transform, are there other means of support apart from the subsidy? Will you provide land or some other support? Now, also in Macau, there is an industry park with the shared GMP factories, and that this can help SMEs adopt a lower threshold in applying for GMP certificate. Will you consider the Macau approach, and that is in Northern Metropolis we can set up GMP factories for shared use by SMEs, and then affordable level of rent can be offered for SMEs to get GMP certification. Have you thought about that? If so, the details. If not, why? The third question relates to the GCMTI. The work of the institute should be acknowledged in ensuring safety and quality of TCMs. In the Hong Kong CMMS, we have 357 types of CMs covered, and this is really commendable. However, if we want to be the bridgehead for CMs to go global, we should also work on aligning the standards with the mainland and the international standards. So what will be the work involved in order to promote the global trading and facilitate trading of CMs overseas? Thank you, Chair. On the GCMTI, I will invite the DH to give you a more detailed response. On GMP, you ask about other kinds of support on top of funding for the industry. We have the Pt2 scheme, and that is a subsidy scheme for upgrading the quality management of CMs. And there is a basic assessment scheme capped at some $30,000. This may not be a big amount, but there is also a subsidy for consultancy service. They pay the consultant up to $100,000, $150,000, or $200,000. There is also another subsidy scheme for GMP equipment, which is capped at $600,000. We have continued to enhance the various funding support schemes. There may be other subsidies available to meet the GMP requirements, such as talent training. So it's not limited to what has been said. And as mentioned just now, if the manufacturer would like to take it further in terms of innovation technology, then the manufacturer may apply for subsidy under the IT fund of the ITC. That comes with a higher amount of subsidy. We note members' comment. We need to get an in-depth understanding of the situation before providing the most suitable help. About GMP, we have 22 or 21 manufacturers with GMP certificate. Now, for the 265 manufacturers as a whole, do they still run factories in other places such as Malaysia? I'll give the floor to the Department of Health. We adopt a principle when it comes to factory requirements. The production line should operate at a scale that meets the factory's requirement. Take medicinal oil as an example. If you manufacture one type of medicinal oil, it can be done in a factory of, say, 5,000 square feet. But if the production line manufactures 50 types of medicinal oil, then there is a chance that you need more than one production line, and that there'll be a special requirement, in particular for medicinal oil for oral use and external use. We also impose another requirement for the production lines to be segregated so as to ensure that there is no cross-contamination. So the size of the factory depends on, for example, the numbers of types of products and the numbers in each batch, and this would affect the design and size of the factory. So basically, if we're talking about traditional medicinal oil, you can just find a factory space with normal clearance. But then if it's for oral use, you need to have greater clearance, because the machinery and equipment to be accommodated would be totally different. Yes, we have seen some successful cases of retrofitting the facilities to meet the GMP requirements. For oral use medicinal oil, since extraction is involved, if the extraction facility is needed, then the line will have to be relocated, because for normal C&I building, the clearance is just 3 meters or 4 meters. So that's the biggest challenge, as I observe. Now, all the factories in the mainland comply with GMP. In Hong Kong, we've yet to achieve that. So, to my knowledge, I mean, are there factories that get GMP certification from other places such as Malaysia? Is there a loophole? The answer is yes. For some factories, they apply for GMP certification in Hong Kong. At the same time, they also apply for TJ certification, because, for example, they may need to export their products to the Australian market. So they might invite the TIC or TJ examiners to come to Hong Kong for certification for export purpose. So it really depends on their export market, whether they wish to apply for certification from another country. Do you have data about the GMP manufacturers in Hong Kong then? We have 21 GMP manufacturers in Hong Kong. About 6 of them also have certificates of GMP from other places. So they should start with GMP in Hong Kong before applying for certification in other countries. That's almost time. I thank members for, I thank the government officials for coming. Anything under AOB? Nothing. So for the October and December meetings, the next subcommittee meeting will be held at 10:45 a.m. to 12:45 on the 27th of October, Tuesday. We're going to discuss 2 items. First, upgrading the CM services through technology, and also promoting R&D development and innovative development of CM. The December meeting will be held at 8:30 a.m. to 10:30 a.m. Friday on the 4th of December. Any views? If not, let's have early meetings. If there are no other views, the Secretariat will issue the notice in due course. If there is nothing on the AOP, the meeting is adjourned. Thank you.